Only on 7 News, a mysterious illness that targets young children and can cause heart attacks in toddlers. The symptoms are deceiving and often mistaken for a typical childhood virus. 7 News anchor Cabrera with the warning signs that could save your child's life.
He is our one who wants to play every sport there is out there.
Meredith and Sean Logan pictured a different future for their son Cooper.
And to try and tame that in a little boy who is so vibrant is hard and sad.
Outside, Cooper looks like your typical 3-year-old. But inside,
this circle here is a right coronary artery aneurysm.
Cooper has a giant aneurysm, a huge bubble in his right coronary artery, the result of Kawasaki disease.
We had no clue. We just really had no clue what it was.
The Logan search for answers started 7 months ago. Cooper went to the hospital with what doctors first thought was a virus, then appendicitis. But surgery and painkillers didn't take away his pain or his high fever.
It was very hard. We sat in that hospital for days on end, and when we got into the 5th and 6th day, it was we knew as parents that it just couldn't be right.
Meredith did notice Cooper's red eyes, one clue to his eventual diagnosis at Children's Hospital Colorado, when its team of Kawasaki disease specialists got involved.
It looks like an infectious disease, so it looks like it should belong to my specialty, but we don't know the cause of it.
Finding the cause is part of Dr. Mary Gloday's research at Children's. She leads one of the few teams in the country researching what many still consider a mystery illness. Dr. Gloday says Kawasaki disease is named after this man, Dr. Tomisaku Kawasaki, who first discovered the disease in Japan in the late 1960s. 7 News learning it is most common in children under the age of 5, an inflammatory disease often accompanied by a rash, bloodshot eyes, red chapped lips, and red swollen hands and feet.
What makes it so hard to diagnose?
Those children, have lots of viral infections, so they have lots of rashes and fevers, etc.
Kawasaki disease is not contagious, but early detection is crucial.
This is the key to combating Kawasaki disease. IVIG therapy, intravenous immune globulin. Essentially, it's plasma that is purified, put into this solution that has antibodies and immune properties that stop inflammation.
They should be treated within the first 10 days of the illness.
Cardiologist Penny Jones says Cooper's case wasn't caught in time to prevent the damage to his heart. Take another look. First, a normal coronary artery.
Looks more like a straw.
Yes.
Less than 3 millimeters wide. And this is Cooper's, 13 millimeters wide. So big, doctors say it will never regress back to normal. But at least it was caught.
If he wasn't treated, yes, he eventually will have clots in his heart and he will have a heart attack.
United in red for heart disease awareness, Cooper's family now forced to spend too much time at the hospital. All the tests, the EKGs, the echocardiograms, becoming household vocabulary. And maybe you've noticed all his bruises. That's because of Cooper's now daily dose of blood thinners. Yet, despite all that, Cooper's spirit remains strong.
And we still don't know for long-term diagnosis how long Cooper will live or what will happen to him in the future, but it's okay that we can move forward and we can do the best that we can and give him the best life that he can have.
Cabrera, 7 News.
And doctors say it is likely that Cooper will have to have heart surgery at some point, and he'll have physical limitations as he gets older. The Logans are putting on a fundraising 5K in Cooper's honor, and you can get all the details, learn more about Kawasaki disease on the 7 News app under the health section.